Hello, I'm here to teach you basic life saving, BLS. What is basic life saving, you say? Well, I'm going to describe that in my video. I have some objectives and a PowerPoint presentation that I'm going to have you follow along to learn all about basic life saving. So getting right to it, let's share my screen here. So basic life saving skills. What are our objectives? So my objectives today are to tell you a little bit about my qualifications, and then to tell you what types of or what basic life-saving skills are, and then also tell you the different levels of basic life-saving, what basic life-saving instructions are. So how do we perform CPR? And then what are the outcomes of basic life-saving? Providing this training to professionals specifically, but also even professionals when they're out in the community need training on how to perform CPR without all of the equipment that they would normally have. So we're going to go through all of those aspects of basic life savings. So moving on to what my qualifications are. I've been an RN for 24 years. I was a diploma nurse to start, and then a Bachelor of Science of Nursing. And I have worked in all different types of settings. So from community setting to birthing suite, delivering children, delivering babies, to primary care, palliative care, chronic complex, surgical care. So a plethora of information that I'm coming to you with and experience. I've been teaching BLS, so basic life savings for heart and stroke, since 2003. So it's been quite a few years, almost as many years as I've been a nurse. I was one of the first heart and stroke first aid BLS or heart and stroke first aid CPR trainers. Heart and Stroke was able to develop a program for first aid in 2014 and then started to train individuals in 2015. And I had one of the developers actually train me. So I'm coming with a perspective of not just my professional qualifications, but also qualifications for teaching individuals that don't have a professional background. So I'm going to describe more about that. So what is basic life saving? BLS, so for short. So when you go to try and find a course for CPR, you may find it under BLS. So there's Red Cross, there's private organizations that will provide it. Heart and Stroke, which I teach for, can provide basic life saving as well as first aid. Now, not all organizations, if they're private or not, may not have the first aid component, may just have the BLS component or CPR component, or vice versa. They may only have the first aid component, and you have to go and get your BLS component elsewhere. So what does BLS refer to? It's the medical care given to individuals experiencing a cardiac arrest, respiratory distress, or airway obstruction. So somebody who does not look well. So they're, unresponsive. They look gray, maybe even bluish tinged lips, nose, ears. And you'll find that mostly the bluish tipped ears, nose, and lips in infants and children, particularly because the oxygen is being depleted. So it's being decreased in the body. So those extremities, fingers, toes, nose, ears, lips, those will become blue quicker. So when you go into respiratory distress, like most infants and children will do before they go into cardiac arrest, there's ultimately that cardiac arrest component. BLS maintains life until medical treatment can be provided by EMS before transfer to hospital. So one of the key components in providing CPR, providing BLS, is to call 911. Make sure that the scene is safe when you've arrived. and you see somebody who's unresponsive or doesn't look well, and you've, screamed out to them, you've yelled out to them, "Are you okay?" And there's no response, call 911. Make sure the scene is safe, make sure there's no fire, wire, gas, glass, or needles. So now we're encouraging people to look around to make sure that there's no needles in the area, because there can be obviously an overdose situation. And certainly when you ensure that that environment is safe and clear for you to approach that person who doesn't look well, and you're able to actually touch them and see if there's responsiveness, hopefully calling 911, the 911 operator is walking you through this and establishing whether that person actually is in distress, has perhaps had a cardiac arrest. So that cardiac arrest, it can happen to anyone at any age, in any place or time. So out in the streets, in your home. And unfortunately, it's something that I have often told people, is that unfortunately, it's our loved ones. So it's our loved ones that might have a cardiac arrest, and this is when these skills come into play. So knowing how to identify that somebody's had either a heart attack or they have had a cardiac arrest, and what to do. Survival is significantly decreased for every minute without access to CPR or an AED. And I'm going to go into a little bit more detail in regards to that decrease of survival rate when we don't provide CPR as quickly as possible, and when we don't have the availability of an AED. So what are the levels of BLS? So there are hands-only BLS. So it can be called heart saver. So if you take it through heart and stroke, heart saver is just hands only. And as I have pictured here, and I'm just going to use my mouse here, identifying this particular picture here with hands only compressions, and it's compressing hard and deep, quite fast as well. We want at least 100 compressions per minute. So that's quite hard. And some people will, when they teach the hands-only CPR, they will reference the song Staying Alive. So, staying alive, staying alive. That beat is the perfect beat to be able to get a compression, the right rate of compression. We want to go quite deep. With the compressions, we want to make sure that we are getting at least a third of the chest. It's the easiest way to try and gauge how deep you need to go. There is some for professionals, 2 inches for adults, almost 2 inches, or 1.5 to 2 inches for a child, and then 1 to 1.5 inches for a infant. But really, if we can just keep it simple across the board, a third of the chest. Every chest circumference is a little bit different. And if we can go a third of the chest deep, then we're getting that heart. We're starting that pump again. That's really the biggest thing. The key issue is to try and start that pump again. So then there's BLS level C. Now, over the last couple of years, just taking a level C BLS course can be difficult to find, because they've kind of changed, and I say they as in heart and stroke, has changed the levels, so that they've kind of eliminated the BLS level C unless you're taking first aid. And I bring it up here because it is a specific level. It's not a provider level. The difference between the level C and the provider is that if you look down in the lower right side of the screen, you'll see there's a couple of individuals that are medics that are working on an individual, and they're working as a team. And that team, when they're working on them, they're hooking them up to perhaps ECG, or making sure that there's a bag and mask. So one person's going to use a bag and mask, and the other person's going to do chest compressions. They're going to put the AED on as quickly as possible. So they're working as a team, as professionals. And so that BLS level C, just taking it alone, they've kind of eliminated that. You must take a first aid course with a level C that doesn't come with a big bag and mask. So that type of training with bag and mask isn't provided. It's hands only, or using a barrier over the mouth. So and then we have our basic life-saving provider, which I've described, working as a team, using a bag and mask, making sure AED is there, and there's teamwork, maybe not just 2 people, but there's perhaps even up to 5 people that are helping to assist this patient to come back to survival. So I just wanted to demonstrate that hands only, and something that in Canada, it's across North America as well as in the UK. There's many examples of hands only, but just so that people have an idea of what hands only is, because it's useful to know when you're out in the community. So let's just see if we can play this. Oh my goodness. Oh dear. Not playing. My apologies. My apologies. Anyway, so we're just going to carry on, and I'm just going to say it. The commercial, the gentleman comes in with his disco outfit because he's playing the music, "Staying Alive," staying alive. And there's 2 women that have call 911 to make sure that everybody knows to call 911. It's a family game night, and somebody ends up on the floor with a heart attack, and he describes, push hard and fast, call 911, push hard and fast, and wait until the paramedics come. Anyway, it's quite cute. If you want to look it up on YouTube, it's under Heart and Stroke, or sorry, I think it's under commercial for CPR. It's not under BLS, commercial for CPR. And if you put Canada, you'll get this particular commercial. Anyway, so steps to provide BLS, steps to provide CPR, which means cardiac pulmonary resuscitation. So I use that acronym a couple of times without telling you exactly that the C starts for cardiac, P starts for pulmonary, and R starts for resuscitation. So it's starting the heart, making sure that there's respirations, and that we're going to bring back this individual. The hope is to bring back this individual. So when we go through the steps, they're quite easy. I've previously described. You're going to see somebody who's gone unconscious. Maybe you see them go unconscious, or perhaps you don't see them unconscious, but they're unconscious. They look gray. They're not breathing or not breathing well. And when I say not breathing well, sometimes what you might hear is this kind of a gasp. It's called an agonal breath. It's a kind of a sound. So they look gray, they're not breathing or not breathing well. And then we want to call 911 and check for responsiveness. And then we're going to check their pulse. So when it comes to an adult, we're going to check their pulse at the neck. So it's the carotid. If they're a child, they have a neck. So this is how I remember it, or I try and teach it. They have a neck, so we're going to check their carotid as well. But infants don't really have necks. They're all kind of squished up. So the closest pulse that we can check for an infant that's closest to the heart is in the brachial. So right inside the inside of the elbow is the best place. And we're going to check that pulse for no more than 10 seconds. So we're checking it for 10 seconds, but no more than 10 seconds. If you cannot detect a pulse and they are not breathing well, they're not responsive, even if you can't detect a pulse, maybe there's a weak pulse, it doesn't matter. We're going to start to do compressions. So we need to landmark. We landmark the heart. And I'm going to show you the picture down here, chest compressions to maintain circulation. Landmark the heart on any body, adult, child, infant, female, male, transgender. It doesn't matter what body it is, between the nipple line or anatomically where the nipple line might be. So there are lots of individuals that may no longer have nipples because of surgeries or various reasons. Anatomically, where we might find the nipple, between that nipple line, there's a hard breastplate. That hard breastplate, the bone, is where we're going to put the palm of our hand. So we're going to put the palm of our hand there. If it is an adult, and you can see here, if it's an adult or a larger child, you may need to use 2 hands. If it's a child or a small adult, maybe you only need one hand. If it's an infant, we're using 2 fingers. So landmarking between the nipple line on that breastbone, and we're going to compress hard and fast. So we're pushing down hard and fast. We're making sure that the chest comes up all the way. We don't want to take our hands off of the chest, but we want that recoil. So the recoil is that the chest is being compressed and then coming up all the way. Whether we, 2 hands, 1 hand, 2 fingers, whatever that is, hard and fast to the beat of Staying Alive. If you're able to provide breaths, so if it's somebody you know, and you want to provide breaths, infants, I usually always want to provide breaths. So if it's somebody you know, or you have a barrier that can go over the mouth, to give breaths, you're going to give 30 compressions and then 2 breaths. So head tilt, allow that head to tilt up so that you can open up the airway so that you can provide breaths. And those breaths really should allow the chest to expand. When the chest expands, we know that we're getting air into the lungs. If the belly expands, we've gone too far and you may end up having somebody puke on you. And I'm sorry that that's a bit graphic, but certainly it can happen. So we're going to compress, give breaths if we can. If not, it's hands only. But like I said, this is something where this particular training is something that I like to encourage providers to make sure that they're working as a team. They might have an ambu bag or a barrier for the face, and they're working as a team. Somebody's providing the breaths, they're staying where they are, and the person who's doing compressions is going to do those 30 compressions so that they can get the compressions to breath ratio, 30 to 2 times 5. So they're going to do 30 compressions, 2 breaths, 5 times. So that's 5 rounds before they're going to check the pulse again. Once EMS comes, when there is more than just 2 providers that are providing that BLS, and the EMS comes, they'll put on, an EKG, see what's going on with the heart. The best thing that we can do is get somebody to get that AED. So what I do encourage people when they call 911, or if they get somebody to call 911, ask them to also bring an AED. We want to put the AED on as quickly as possible. Best rate of survival is if the AED actually goes on before you start compressions. So your likelihood of survival, somebody's likelihood of survival of a cardiac arrest, if the AED comes, is almost 75% more. So it's really something that I encourage people to make sure that they know where AEDs are. In local stores have them now, a lot of grocery stores, churches, recreational complexes, they all have AEDs. So always kind of be aware of where they are, because like I said, anyone at any time can have a cardiac arrest. So if or when the AED arrives, continue to do compressions as that person who has the AED puts the AED on around you. So if you've already started to do BLS, if you already started to do that CPR, then you want the person who's got the AED to work around you, because we don't want to stop those compressions. We want to be able to provide the heart, which is a pump, to keep pumping. So what do we want to remember? We want to remember to check the carotid pulse on adults and children, which is at the neck. We want to remember to check the brachial pulse on the inside of the elbow of an infant. We want to make sure that we compress 1/3 of the chest for optimal circulation. We want to also remember to give breaths that the chest should rise, not the abdomen, not the stomach. Also, if there are 2 people reviving an infant, this I didn't point out, if there are 2 people reviving an infant, the compressions to breath ratio changes to 15 to 2. And something I said earlier was that once we go into respiratory distress, we will automatically go into our cardiac arrest. Infants generally don't have the same kind of risk factors that we do as adults have. They haven't eaten enough McDonald's. So because they haven't eaten enough McDonald's, they're not getting, clogged arteries and issues with their heart. So they usually will go into cardiac arrest because they've gone into respiratory arrest from choking or from suffocation, drowning. So even adults, when they drown, they've gone into respiratory arrest, then they go into cardiac arrest. So we want to get that infant, particularly, more oxygen more often. So changing that ratio from 15 compressions to 2 breaths allows more oxygen to be able to be promoted throughout the body. We want to make sure that AED is put on as soon as possible. And of note, we can put an adult AED pad on a child or an infant. We just sandwich them. So if they are small, we're going to sandwich them because we don't want the pads any closer than 2 inches apart. So with children and infants, if you're putting a pad on and you're putting a pad here and you're putting a pad just under the auxiliary, so the armpit on the chest. And if they are starting to touch, then we want to sandwich the person. So put it on the chest and put it on the back. Something else we want to remember, because we want to close that loop. I apologize. We want to close that loop. Something else we want to remember is that if an individual has a lot of hair on their chest, the AED pads will not stick. So those AED pads won't stick. What can we do? A number of things. Shave. A lot of the kits have razors. Cut with scissors, cut the hair off. Certainly that's not the optimal. If we have extra pads, we use them to wax. But another really good, just not even going that far, another really good option is just to put the pads where there's not as much hair. So one really good spot is on underneath each armpit, so that you're kind of sandwiching the person kind of sideways. That really works well because it then closes the loop, that electrical loop, so that you can shock the person if you need to. So, outcomes. When do we stop doing CPR? So just before we get to those specific outcomes, we want to stop CPR when somebody revives, of course, put them in recovery position. If the EMS comes, of course, that's certainly a spot, a time to stop CPR. If we have somebody else who's going to come and help us, so if we can work off of each other when we get tired, then that other person can take over, and maybe we switch with the breaths and the compressions. Even in hospital, when you're working as a team in hospital on a code blue, people may even switch around to try and coordinate care. But the other time that you will perhaps stop is when you can no longer go yourself. It can be a time when the EMS doesn't get there in time and you're spent. Adrenaline usually kicks in, and the adrenaline will allow you to carry on for many more minutes than you think. But certainly there is a time when you can no longer, your body physically just can no longer continue with CPR. It is quite taxing. So that's when you would stop as well. So only 1 in 10 people survive cardiac arrest outside of hospital. And I know that doesn't sound like a really good statistic, but that statistic does raise if you have an AED and if you know CPR. So this is why this video is important. Know CPR, even if it's hands only, know CPR so that you can provide that basic life-saving to somebody who might be in a critical condition. So it increases by 2 out of 10 have a better rate of survival if they're using an AED alongside CPR. So I referenced a number of different techniques for BLS, different types of BLS, different types of CPR, and my references include American Heart Association as well as Heart and Stroke. And I've left them here for you to look at in case you are interested in further educating yourself about BLS and CPR. Thank you.